everybody. This is Kristi Talmadge coming to you from Connecticut in Bristol. I hope you all had a very great holiday and you're going to have a happy new year. Let's see. I got sick. Why does this matter? Well, everybody's getting sick right now, so it's a topic of conversation. We've been dealing with the COVID-19 pandemic for the last almost 2 years. There's been a lot of bickering in the news about it. There's been a lot of narrative changes. And there always does seem to be an approved narrative because a lot of people get banned from social media if they question it. And I have mentioned in the past that I went ahead and got the Moderna shot and the second one, the first two. I volunteer at the Homeless Outreach Center. And the lady there, it's a lot of the volunteers are older, they're retired, and they're at that age that they're more at risk if they get sick. So, I went and I did that because we don't want to get the clients sick either, the folks that come in for services. So I went ahead and did that for her. And then my daughter had lost a baby, very young, just a few months old, from trisomy 13. And she had another baby. And I wanted to go visit, as did my younger daughter. And my older daughter, who had the baby, Serafina, asked that we get vaccinated because she didn't want to take any chances. And that's understandable. We didn't know what was going on. A lot of people have died, especially the vulnerable. So yes, that's another reason I went ahead and got vaccinated. It was a new vaccine. I did have a lot of questions, but people were dying. People were afraid. I didn't want to cause any problems. I wanted to continue volunteering. I didn't want to get sick. So yeah, I went ahead and got the vaccine. When I got the vaccine, I was going on the knowledge that these vaccines, Moderna or Pfizer, were between 94 and 95% effective. That's pretty good. I'm pretty impressed. And, considering what my options were, there was also the Johnson & Johnson vaccine, which was only like 66% effective. And I'm like, yeah, I don't want to be bothered with that. And who knows if it's going to work. So I went ahead and I got this Moderna shot and I was very happy about it. And, I didn't ever support mandates. I think it's a choice. I know a lot of people are going to get mad at me for that. And there's a lot of reasons I didn't support the mandate. One of the reasons is public trust, and the government doesn't really have it. You have to be able to trust your government when they're telling you, okay, this is what you need to take to get better. But unfortunately, a lot of people feel like Big Pharma has been in control of a lot of this and feel as if the narrative changes depending on who's in charge. And I really wish that everybody from the FDA, the CDC, the politicians, all the scientists could just walk in tomorrow into the room and take the broom and sweep their little heads of all their preconceived notions and everything that they've thought about COVID-19 and walk into the room and take the situation that we have right now, which is extremely high cases. Last year, Connecticut's positivity rate was 5-point-something% at this time. And as of our last data report, we were up above 20% of COVID-19 positive cases. So if the government felt last year at this time that this was an emergency with 5%, a little above 5% of cases, and our Governor Ned Lamont, has had us in a state of emergency for almost this whole time, and this now we're up over 20%, why aren't they a little bit more, freaking out about it, I guess? Instead, it seems like they're like, okay, Omicron isn't as serious or as deadly of a variant, so we're not going to take it as seriously. But people are already scared. This has been going on for the last year and a half, and people are thoroughly terrified of this disease. I listen to people talk. I listen to people fight over it, which is the absolute worst, about who's getting it, who's not getting it. Should you be vaccinated? Should you not be vaccinated? Are you a better person if you're vaccinated? Are you a terrible person if you're not vaccinated? Dude, nobody wants to get sick. I think we can all agree on that, right? Nobody wants to get up and say, oh, I feel like crap today, blah. And nobody wants to die. But whether or not you're going to put this vaccine into your body that may or may not provide the effectiveness they initially said that it would, that's something that you have to think about. I don't feel like it's my job to say you got to take it. So, I don't. If you've taken it, I love you. If you haven't taken it, I love you. It doesn't really factor into my decisioning whether or not I think you're a good person or anything else. And I find it very frustrating to see people fighting over it so much and not talking to family members. And if you're older, I think it's better that you get it. You look at the statistics, and the majority of the people that have died are over the age of 50. Gets a little riskier in between 40 and 50. The younger people, I could see why they might not want to take it, that they're healthy, because there are side effects. And I don't see just our government coming together overall and just giving us an information sheet with the facts. We need a new one of those. These are the new facts. This is what we're dealing with, because everybody's arguing because of the confusion. And I did make myself a little notepad few list thing here, so I didn't forget about everything I wanted to talk about. But I got a little frustrated because as I was watching these cases go up, all of a sudden I started to not feel good. And so I've gotten these vaccines and I got the flu shot, and now I don't feel good. And I'm like, well, I better go take a test because I don't want to pass it to anybody else. And I go, look to see where to take tests. And I realize a lot of these places are drive-through tests. And I don't have a car. I don't drive. I walk everywhere. I just got my license. Yay for me. But I don't have a car yet. I'm working on that. So then I start looking for at-home tests on Amazon. And they had them, but there was no delivery until between January 7th and January 10th, I think it was. So, okay, what about the local stores? So I look up CVS and there's nothing there. There's none, not in stock online. And so I called a couple and nope, they don't have they're all out. So I'm a little aggravated. I'm like, okay, what's going on? So I get back up on the Twitter, and I like to hang out on Twitter. And I'm looking around for articles to see what's going on. And I realized that we have this national backup of over-the-counter tests. And I'm like, why? And I'm looking at these cases going through the roof. There are lines that are hours long that people are waiting to get tests. Some of them are healthy, but they have to get them for work. And I don't know, now is the best time to be making healthy people get tests when a lot of people are sick, but I'm not in charge of that. Hours. And we had, because I live in Bristol, I was near the 111 North Main Street testing center. I live near that. And they had somebody make an empty gun threat because they were so frustrated for waiting for hours in line, waiting for this test. And we've got people frustrated. They're running out of tests. So they're running out of the PCR test too. And then you have the CDC gets online, gets on the news stations the other day. And I saw a few interviews of the CDC director. One was with Caitlin Collins. One was with ABC News. And they announced that they're having the quarantine times, the isolation times for people that are asymptomatic, which is kind of a key word, asymptomatic. Not everybody's Typhoid Mary. And I knew as soon as I saw that people were going to freak out. So as I'm trying to gauge the response to that, of course, you have people that are against vaccine or any of that stuff because they're like, it's just a cold. So I'm not going to argue with that. If if that's what you feel, then, you're your own person. I think you should get it if you're older, if you're younger, whatever. It's not my health decision to make. I think, and here's why I stopped it. Because if this vaccine was actually 94 to 95% effective, if it was, and the death rate was higher than it is, because it's, I think, 1.6%, and it skews, if you catch it, and it skews really, really heavily toward the elderly. The older you get, the worse it gets. So if it was 94, 95% effective and the death rate was, was worse, then I would say, yeah, fine, mandate it if it prevented the disease. And I see all of these court cases going through on religious rights and this or that. Well, I'm going to bet that the court and no politician wants to be the one who said, don't take the vaccine and then you get sick and then you die. Nobody wants to be responsible for that. If they hear a vaccine has a chance of making you feel better and not dying, they don't want you dying on their watch. They want you to take the vaccine. But people have legitimate concerns. There are some side effects. And I heard a lot coming up in the last few days. I've seen it going on for months, but more so in the last few days, about the CDC VAERS database. There's this argument going back and forth that, okay, there was 8,000 something deaths listed in this database. And then there's people on the other side saying, but these are self-reported. This isn't actually evidence that something is wrong or that these were actually caused by the COVID vaccine. It's a vaccine database. So in my mind, instead of even having this argument, because I see politicians having it, I see scientists having it, I see news people having it, I see lay people on Twitter that are confused and arguing back and forth, they're having the argument. Why hasn't the CDC or the government just investigated these 8,000 something reports to figure out if they're related to the vaccine or not? Because if they're not, that would make people feel better. Don't we have a public trust thing? Can't we talk about it? But apparently, if you talk about things, the powers that be that are in charge get mad. And I don't understand why we can't have discussions, especially now that a lot of us that have had this vaccine are getting sick. It would be really nice if we could have the conversation and a new fact sheet if you need to. Listen, it's only this effective now. And if you only have to isolate for 5 days, once you feel better, fine. Or if you have to test and the tests, we have the shortage of tests that I started this conversation out with. And Joe Biden and the administration decided they were going to get 500 million tests out to everybody. Because this is the next thing I went to look at when I realized I couldn't buy one online. Oh, great. Joe Biden's giving us all these tests. This is fantastic because I need one. I'm sick. These are the over-the-counter at-home testing kits. So nobody can find any, and there's shipping delays in the state of Connecticut. I know some places got them, some places didn't around the nation. I know not every state was the same. You're not in the same boat. But in Connecticut, our governor had thought he secured some. And it turned out that the person that he was securing these tests from, we had a middleman. So his middleman had been getting PPE from China for us for during this whole pandemic. So he's a great dude for getting this Chinese available PPE for us because we couldn't get any in the States. And we were using that person to also facilitate getting our test kits. It fell through. Some other state or some other entity offered them more money or something, and money hadn't changed hands from Connecticut to them yet. Whatever, test fell through. Now they've got the tests and they want us to be all happy. This is days later. We were promised them on Wednesday, I think Governor Lamont promised them, and then they didn't come through. And I don't know, my town, Bristol, is maybe doing them on Tuesday. I'm not sure, Monday or Tuesday. The news changes. So I'm sitting there and I'm thinking to myself from the last 2 years, I pay attention to politics. I pay attention to the different way politicians react and the media reacts and people react based on who's in charge. And it could be the same situation, but the attitude changes depending on who's in charge, and we need less of that. Because it doesn't matter who's in charge. It doesn't matter if it's good for your election or bad for your election. What matters, if we started this whole conversation about public health and we care about public health, then let's talk about public health. What is best for public health? I don't hear anybody asking in the courts whether the government has authorization to mandate vaccines that aren't working properly. I want real data. What is the current data on this? Because 94 to 95% effective, obviously, after a booster shot, I got my booster. So how many more months does that give us? Does that give us another 6? At what percentage effectiveness? We deserve that answer. That's not questioning the science. I don't want to get banned for it. I just want to know what percentage are people covered really, for real, now with the Omicron variant hanging around and the Delta variant. How effective is this vaccine now? We deserve that answer. Pfizer told us back in May when they applied for the emergency use authorization that their vaccine prevented COVID-19 disease in ages 16 and older. They said prevented. They told their investors prevented. They tweeted out it prevented. And a lot of people are getting sick. So it's understandable that people right now still think that it's going to prevent the disease. And a lot of people do, and they're frustrated when they get sick anyway. Don't feel bad if you get sick. Don't feel bad if you're unvaccinated and you get sick. Don't feel bad if you're vaccinated when you get sick. Nobody wants to get sick. Stay home, be miserable. Take NyQuil and DayQuil or whatever generic version your store has. It worked great for me. But I want us to be able to talk about it. And I see that they're banning doctors, even if you don't like them. I saw this Dr. Robert Malone guy that was on Joe Rogan. He got banned, suspended permanently from Twitter. I've watched like maybe 3 or 4 Joe Rogan episodes ever. One of them was with Elon Musk. But I'm going to listen to this thing because I want to know why, after 40 million people watched it, Google pulled it from YouTube and Twitter said we couldn't watch it and they suspended this guy. So the first thing I want to do when somebody tells me I can't is I want to see what it is. So I'm going to go look. So anyway, I would like to see less divisiveness over COVID-19 and more honesty from our politicians. Blumenthal, I had mentioned it a couple of times. Why is it that Chris Murphy and other senators were asking for the Defense Production Act to be used, and now they're not, because Biden is in charge instead of Trump. And now finally Blumenthal said anything. So maybe we'll get some more test kits that way through the Defense Production Act. I just don't want us to fight over it. I want honest information. I want us to be able to question it. Why can't we talk about it? I'd like to be able to talk about it. I'm all jabbed up. I'm obviously not an anti-vaxxer, but I'm not going to be mad at you if you decided you didn't want it, because not everybody's an anti-vaxxer. Most of the people I know that didn't get the COVID vaccine got all the rest of their shots. Okay, so there's a lot more that I want to talk about. I'm going to do future casts on more on the economy, a little bit on marijuana. I want to talk about minimum wage in the future and just wages in general. I want to talk a little bit about inflation, especially as it's affecting car prices and housing costs right now, because that affects me, and I know it probably affects a lot of you. Okay, I am signing off. I hope you all have a wonderful evening. Tomorrow's Monday, and nobody likes that. But, enjoy your evening tonight. Rest. Have a great one. Talk to you later. Bye-bye.